Good evening, everyone. Before I say another word, I want you to sit up for a moment and really listen to me, because what I'm about to share with you could save your life, or the life of someone you love, a parent, a grandparent, a spouse, an older neighbor you check in on every week. I've spent years in clinics and hospital wards, sitting across from patients who came to me a little too late, patients whose bodies had been whispering to them for months, sometimes for over a year, and they simply didn't know how to listen. Pancreatic cancer is one of the quietest, most cunning diseases I have ever encountered in my career. It doesn't announce itself with a dramatic collapse. It doesn't come with a siren. It creeps in through small, forgettable symptoms. A little less appetite here, a little more tiredness there, a belt that suddenly feels loose, and by the time most people finally walk into my office, the disease has already had a considerable head start. That is exactly why I am standing here today, speaking directly to you, because if you are a senior, or if you love a senior, this speech is not just information, it is a warning, and it is also a gift, because early detection with this particular cancer changes everything. I want to start by telling you something that might surprise you. The pancreas is a small, unassuming organ, tucked deep behind your stomach, quietly doing two enormous jobs every single day of your life. It produces the enzymes that break down your food, and it produces the hormones, insulin among them, that keep your blood sugar in balance. Because it sits so deep in the body, tucked behind other organs, tumors can grow there for a long time before they press on anything that causes obvious pain, or before they show up easily on a routine scan. This is why doctors like me call it a silent disease. It doesn't scream, it murmurs. And in our senior years, when our bodies already carry the ordinary aches, the ordinary fatigue, the ordinary slowdown of appetite that comes with age, those murmurs are far too easy to dismiss as just getting older. I have heard that phrase so many times in my career. I thought it was just old age, doctor. And I have watched families grieve because a symptom was brushed aside for months. Tonight, I want to make sure that never happens to you. So let's walk through this together, symptom by symptom, the way I would sit with a patient in my own office, taking my time, explaining not just what to look for, but why it happens, so that this information sticks with you long after tonight. The first sign I want you to burn into your memory is unexplained weight loss. Now, I know what you might be thinking. As we age, our appetite naturally shifts, our metabolism slows, and a few pounds here and there don't necessarily mean anything sinister. And you're right, in most cases, they don't. But there is a very specific kind of weight loss that worries me as a physician, and that is weight loss that happens without any real change in diet or activity. If you or your loved one has dropped 10, 15, 20 pounds over a couple of months, and nobody started a new diet, nobody took up marathon training, then that is not normal aging. That is your body telling you it is burning through its reserves for a reason you haven't identified yet. With pancreatic cancer specifically, this happens because the tumor can interfere with the pancreas's ability to produce the digestive enzymes your body needs to break down fats and proteins. So even if you're eating the exact same meals you always have, your body may not be absorbing the nutrition from them the way it used to. On top of that, cancer cells are metabolically demanding. They consume energy from the body in ways that create a kind of quiet, internal drain. A drain that shows up on the scale before it shows up anywhere else. I always tell my senior patients, weigh yourself regularly, not obsessively, but regularly, because the scale can catch something your eyes in the mirror might miss. The second symptom, and one of the most classic warning signs in all of medicine, is jaundice, that yellowing of the skin and the whites of the eyes. Now, this one is dramatic when it finally shows up, but here's the tricky part, the part that catches families off guard. It often develops gradually. A family member might notice it slowly, day by day, and because it creeps in rather than appearing overnight, it can be mistaken for a suntan, for lighting in the bathroom, for simply looking a little different. Jaundice happens because tumors in the head of the pancreas, which is the most common location for this cancer to originate, can press against or block the bile duct, the small tube that carries bile from the liver and gallbladder into the small intestine. When that duct is blocked, bile backs up into the bloodstream, and that backup is what turns the skin and the eyes yellow. But jaundice doesn't travel alone. I want you to look for its traveling companions. Darker than normal urine, the color of strong tea or even cola, and stools that turn pale, clay-colored, almost chalky in appearance. This combination, yellow skin, dark urine, pale stools, is one of the strongest signals in medicine that something is obstructing the bile flow, and in a senior patient, it absolutely warrants an urgent visit to a doctor, not a let's wait and see approach. The third symptom is abdominal and back pain, and this is one where I have to ask you to pay very close attention to the pattern, because ordinary aches and pains are so common in our senior years that this particular warning sign gets buried constantly. The pain associated with pancreatic cancer tends to start in the upper abdomen, often just below the breastbone, and it frequently radiates straight through to the back. Patients describe it to me in different ways. Some say it's a dull, gnawing ache. Others describe a deep, boring sensation. And many tell me it gets worse after eating, or worse when they lie flat. And interestingly, some feel a bit of relief when they lean forward or curl into a certain position. This happens because as a tumor grows, it can press on nerves and structures behind the pancreas, and because the pancreas sits so close to the spine, that pressure telegraphs itself right into the back. If you or someone you love has a persistent ache in the upper belly that radiates to the back, that doesn't resolve with the usual remedies, antacids, rest, a heating pad, and it has been going on for weeks rather than days, please do not brush this off as just my back or just some indigestion. Bring it to a physician's attention and ask directly whether pancreatic imaging should be considered. The fourth symptom is one that catches even seasoned doctors off guard sometimes, and it is the sudden onset of diabetes, or a sudden worsening of blood sugar control in someone who already has diabetes, especially when there's no obvious explanation like weight gain or a change in diet. Here's what's happening physiologically. The pancreas is the very organ responsible for producing insulin, and when cancer begins to grow within it, it can disrupt the normal function of those insulin-producing cells long before the tumor is large enough to be easily detected. In fact, this connection is significant enough that doctors specifically watch for what we call new onset diabetes in an older adult, as a potential early red flag for pancreatic cancer, particularly when that diabetes appears alongside unexplained weight loss rather than weight gain, which is the more typical pattern we'd expect with ordinary type 2 diabetes. So if you're over 60, 65, 70 years old and you're suddenly diagnosed with diabetes, or your blood sugar numbers that have been stable for years suddenly become difficult to control despite following your usual medication routine, I want you to have a direct conversation with your doctor about this connection. It doesn't mean you have cancer. Most new diabetes in seniors is simply new diabetes, but it is a thread worth pulling, especially if it's paired with any of the other symptoms I'm describing tonight. The fifth symptom is loss of appetite, and closely tied to it, a feeling of fullness after eating just a small amount of food, something we call early satiety in medicine. I want you to picture a senior who used to enjoy a full dinner plate and now finds that just a few bites leave them feeling stuffed, bloated, uncomfortable, and simply uninterested in finishing the meal. Families often interpret this as they're just eating less because they're older, and sometimes that's exactly what it is. But when it happens alongside weight loss, when the food genuinely no longer appeals the way it used to, and when this aversion seems to specifically apply to fatty or rich foods, that is worth noting carefully. This happens partly because the tumor can affect digestive enzyme production, meaning fatty foods sit heavier and digest less efficiently, and partly because advanced tumors can release certain compounds into the bloodstream that suppress appetite directly, a phenomenon we sometimes see in various cancers throughout the body. If a loved one who used to have a hearty appetite suddenly seems to have lost their enthusiasm for food altogether, and it's persisted for more than a few weeks, that deserves attention, not dismissal. The sixth symptom involves changes in digestion that are a little more uncomfortable to discuss, but I promise you, this information is important enough that I'm not going to shy away from it. I want you to pay attention to changes in stool, specifically stools that become pale, oily looking, foul smelling, and that float or are difficult to flush. This happens because, As I mentioned earlier, the pancreas produces enzymes essential for breaking down fat. When those enzymes are reduced because a tumor is interfering with pancreatic function, fat passes through the digestive system undigested, and that undigested fat is what creates this particular type of stool, something we call steatorrhea in medical terms. I know this is not comfortable dinner conversation, but I promise you, this is exactly the kind of detail that a modest, private, I didn't want to mention it symptom can be the very clue that leads to an early diagnosis. If you notice this change, or if an aging parent mentions something similar to you, please don't let embarrassment stand between that information and a doctor's ears. The seventh symptom is fatigue, but I want to be very precise about the kind of fatigue I mean, because ordinary tiredness is such a universal part of the aging experience that I don't want you running to the emergency room over a bad night's sleep. What I'm describing is a persistent, heavy, unrelenting exhaustion that doesn't improve with rest, that isn't tied to a poor night of sleep, and that seems to be getting steadily worse over weeks or months rather than staying steady or improving. This fatigue often comes from a combination of factors working together: the poor nutrient absorption I mentioned earlier, the metabolic burden that cancer places on the body, and in some cases, a mild anemia that develops quietly in the background. When this profound, unexplained exhaustion shows up alongside any of the other symptoms I've already described, the weight loss, the appetite changes, the abdominal pain, it adds another piece to a puzzle that your doctor needs to see in full, not one piece at a time spread across different appointments over many months. And the eighth symptom, the one I want to leave you with tonight because it is so often overlooked, is the sudden development of a blood clot without any clear cause, what we call a deep vein thrombosis when it occurs in the leg, or a pulmonary embolism when a clot travels to the lungs. This might seem like an odd symptom to associate with the pancreas, and I understand why it feels disconnected at first glance. But there is a well-documented relationship between certain cancers, including pancreatic cancer, and an increased tendency for the blood to clot. We call this paraneoplastic phenomenon in medicine, and it happens because tumors can release substances into the bloodstream that shift the body's clotting balance. So if a senior suddenly develops a swollen, painful leg, or experiences unexplained shortness of breath and chest discomfort with no obvious cause like a recent surgery or a long flight, and there's no clear explanation, this is a symptom that deserves urgent medical evaluation, and it's one that a good physician will want to investigate thoroughly, sometimes uncovering an underlying cancer that hadn't yet been suspected. Now, I want to step back for a moment, because I know that listening to a list like this can feel frightening, and I don't want fear to be the thing you walk away with tonight. I want clarity to be what you walk away with. None of these 8 symptoms, taken alone, means that pancreatic cancer is present. Weight loss can come from countless benign causes. Fatigue is one of the most common complaints in any doctor's office, tied to everything from poor sleep to thyroid issues to simple stress. Digestive changes happen to almost everyone as we age. What I want you to take from tonight is not panic, but pattern recognition. It is the combination of symptoms, the persistence of symptoms beyond a few weeks, and the appearance of symptoms that don't fit a senior's normal baseline that should prompt a conversation with a physician. I always tell my patients' families the same thing. You know your loved one better than any test, any scan, any lab result. You know their normal appetite, their normal energy, their normal digestion, their normal weight. When that normal shifts significantly and it doesn't bounce back, trust that instinct enough to bring it to a doctor's attention, clearly and specifically, rather than letting it dissolve into, oh, they've just been a little off lately. I also want to speak directly to the seniors listening tonight, not just the caregivers and family members. If you are the one experiencing any of these changes in your own body, please do not minimize what you're feeling because you don't want to worry your family, or because you assume a doctor will simply tell you it's nothing, or because you've convinced yourself that at your age, aches and slowdowns are simply the toll of a long life well lived. Your body has earned the right to be listened to, not dismissed. Advocate for yourself the way you would advocate for your own children or grandchildren if they came to you with these same concerns. If your doctor examines you and reassures you that everything looks fine, that's wonderful news, and I hope that's exactly what happens every single time. But if your symptoms persist despite reassurance, it is completely appropriate, and I would say it is your right to ask for further testing. Whether that's blood work looking at specific markers, an ultrasound, a CT scan, or a referral to a gastroenterologist who specializes in exactly this kind of evaluation. I think it's worth mentioning why early detection matters so profoundly with this particular cancer. Pancreatic cancer has historically been one of the more difficult cancers to catch early, precisely because of everything I've described tonight: its deep location in the body, the subtlety of its early symptoms, and the way those symptoms mimic so many ordinary benign conditions. But when it is caught early, when a tumor is still localized and hasn't spread to other organs, surgical options become available that simply aren't on the table once the disease has progressed further. This is exactly why I'm spending this much time walking you through these 8 symptoms in such detail. This isn't fear-mongering. This is arming you with the kind of specific, actionable knowledge that can shift the timeline of diagnosis from late stage to early stage. And that shift, in this particular cancer, can be the difference between a treatment plan focused on cure versus one focused primarily on comfort and management. I also want to touch briefly on who tends to be at higher risk, because this matters when you're deciding how seriously to weigh these symptoms. Age itself is a significant risk factor, with the majority of cases occurring in people over the age of 65, which is exactly why this conversation matters so much for the senior community specifically. A family history of pancreatic cancer, especially in a first-degree relative like a parent or sibling, raises the risk further. Long-standing diabetes, chronic pancreatitis, smoking history, and obesity all contribute additional risk. If you or your loved one falls into several of these categories, and you're also noticing one or more of the 8 symptoms I've described tonight, I would gently but firmly encourage you to bring all of this information to your physician in one conversation, rather than mentioning it piecemeal across separate visits where the full picture might not come together. I know medical information like this can feel heavy, and I know that for some of you listening tonight, this isn't abstract at all. Maybe you're hearing this because you've already noticed one of these symptoms in yourself or in someone you love, and your heart rate has picked up a little just from listening. I want you to take a breath. The next right step isn't panic, and it isn't Googling worst-case scenarios at 2 in the morning. The next right step is simply making an appointment, sitting down with your doctor and saying clearly, I want to talk about these specific symptoms, and I want to understand whether pancreatic health should be part of this conversation. A good physician will take that request seriously, will listen carefully, and will guide you toward the appropriate next steps, whether that's simple observation, basic blood work, or more advanced imaging. I want to close tonight by reminding you why this conversation matters so much to me personally, and why I believe it should matter to you too. Every single day, I meet families who tell me the same story with slightly different details. A parent who seemed a little more tired than usual. A grandmother who mentioned her stomach felt off for a few weeks. A husband who noticed his wife's clothes were getting looser and thought it was simply a positive sign of healthy eating. In hindsight, every one of these families wishes they had connected the dots sooner, not because they weren't paying attention, but because nobody had ever sat them down and explained, clearly and specifically, what to actually watch for. Tonight, I've tried to be that voice for you. I've tried to give you the specific, practical knowledge that so many families only receive after it's too late to change the outcome. My hope, my genuine hope, is that by sharing this with you, by walking through unexplained weight loss, jaundice, abdominal and back pain, new onset diabetes, appetite loss, digestive changes, unexplained fatigue, and unusual blood clots, I've given you a map. Not a map of fear, but a map of awareness. One that you can carry with you into every doctor's visit, every family dinner, every quiet moment when you notice something just slightly different about someone you love. Take this seriously, but take it calmly. Watch for these signs, but don't let watching become worrying. Trust your instincts, trust the instincts of the people who love you, and never let embarrassment or busyness or the simple assumption that it's probably nothing stand between a real symptom and a real conversation with a real doctor. That conversation could be the single most important few minutes of a person's entire life. If tonight's speech gave you something valuable, if it gave you a piece of knowledge you didn't have before you sat down to listen, then I want to ask you for something small in return. Please hit that subscribe button, because there is so much more health information like this that I want to bring directly to you and to families just like yours. Information that could genuinely change the course of someone's life if it reaches them early enough. And please, leave a comment below. Tell me if you or someone you love has experienced any of these symptoms. Ask me any questions this speech may have raised for you, or simply share this with someone in your life who needs to hear it. The more this information spreads, the more lives it has the potential to touch. Thank you so much for listening tonight, for giving me your time and your attention on a topic that truly matters, and I'll see you again very soon.